To understand achalasia, first we know about the esophageal motility. So, when food enter in the esophagus, so then there will be the contraction of the esophageal muscle behind that food and pushing this food toward the lower esophageal sphincter. So how the esophageal motility is controlled? To understand the esophageal motility, we know about the different neuronal plexus that present in the esophageal valve. So the first layer of this is the lumen of the esophagus, and this is the inside is the epithelium. Then after that, there's a mucosa, and this is a inside circular layer of the muscle and outside longitudinal layer of the muscles. So the submucosal plexus that present below the submucosa, this plexus control secretion and blood flow while the plexus that present in between the circular and longitudinal layer of the muscle, that Myenteric plexus control the motility of the esophagus. So the achalasia is basically the degeneration of the inhibitory neurons that present in that Myenteric plexus, particularly the nitric oxide, NO, and vasoactive intestinal polypeptide when food reach the lower esophageal sphincter. So the inhibitory neuron that present in the myenteric plexus release NO and VIP, vasoactive intestine, that lead to the relaxation of this sphincter. So the relaxation of the lower esophageal sphincter by the nitric oxide and VIP. These are the neurotransmitter, and food enter in the esophagus. Food enter into the stomach. So in case of the achalasia, these inhibitory neuron that present in the myenteric plexus are degenerate. So the presentation of the achalasia is difficulty in swallowing to both solids and liquid. Chest pain, regurgitation of undigested food, weight loss, and nocturnal cough. Because of these two symptoms are due to the food does not enter into the stomach and digestion does not take place. So the diagnosis of the achalasia, first investigation is the endoscopy. Endoscopy basically to rule out the structural disorders like pseudoachalasia, as particularly the cancers. Next is the barium swallow. Barium swallow reveal bird beak appearance of the distal esophagus. Manometry is basically the definitive test for the diagnosis. It show increased lower esophageal sphincter pressure, decreased peristalsis, and decreased lower esophageal sphincter relaxation. So the chalasia mainly divide into the two types. The primary causes are the idiopathic. Second one is the secondary chalasia. Secondary chalasia due to Chagas disease, Chagas disease, and due to extraesophageal, extraesophageal, extraesophageal cancers. This Chagas disease is basically due to the T. cruzi infection. The treatment of achalasia divided into the two types. Short term. The short term treatment includes nitrates, calcium channel blockers, and botulinum injection. Botulinum injection at lower esophageal sphincter, while the long-term treatment includes Heller myotomy, Heller myotomy that increase the risk of GERD, increase risk of GERD. Pneumatic balloon dilation, pneumatic balloon dilation for achalasia.